Namaskar, hello and welcome to CIET NCERT's special live phone-in program, and we bring you a series called Meet the Author. My name is Tanvi Khurana and I welcome all of you to this online series of vocationalization of school education, and our today's topic is Vision Technician. Well, the name itself suggests that it is from the healthcare sector, and we all know that the Indian healthcare sector is growing at a brisk pace and it has a lot of job opportunities attached to it. Well, the healthcare sector is India's largest market in terms of both the revenue and even the employment. And if we're talking about vision technician, let me just talk about its role. Well, the role of vision technician is of utmost importance. The technician assists the doctors in the examination. The technician prepares the patients for the vision test. He explains the patients regarding the test and arranges the equipments, cleans the room, and a lot more things. So this is going to be a really interesting topic, and we have an expert with us. So let's meet him. He is Dr. Abhijit Nayak. Welcome, sir.
Thank you. Thank you, friend.
Thank you, sir, for being with us. Sir is the professor and head of the Department of Health and Paramedical Sciences from PSS Central Institute of Vocational Education, Bhopal. So, sir will be talking about vision technician. If you have any queries, any questions regarding this topic, then please feel free to send your questions through our YouTube channel, which is NCERT Official. In the live chat box, you can write down your questions, queries, and share them with us. And if you have any stories, any experiences, any instances to send us, then please do that as well. This is the book Vision Technician for all the class 9 standard students, and you're watching us on PMeVIDYA channel number 9. And if you want to call us and raise your queries, the number is 8800 440 559. Well, so far in this series, we have talked about a lot of things. For example, plumbing, agriculture, animal husbandry, paddy farming, and many more. So today we are talking about vision technician, and let's begin this discussion, and I would like to ask sir for the opening remarks on this topic and ask him that sir, what is this session all about? What are our viewers going to gain knowledge from this session?
Yes, thank you, ma'am. Actually, this session is all about the textbook regarding the job role of vision technician.
Okay.
And as you said, it's a very demanding job role in the market of healthcare sector, which is growing, say, at the rate of 29% annual. And it has a lot of scope from the point of job perspectives in the market. And a vision technician is rather indispensable if he is absent in the vision clinic, and the doctor becomes helpless as far as his profession is concerned. And this course, which we have designed, is for class 11 as class 12. And today I shall be discussing the points which have been discussed in this book for 11th as well as for class 12.
Okay, so shall we begin?
Yeah.
Okay.
Thank you, ma'am. Thank you.
Yes.
Friends, let me start. Vision technician, as the word prescribes and says, that this is a role which is played by a skilled manpower trained in the area of vision related subject, or in scientific word we call it as ophthalmology. Now, a technician's job here becomes very important in the sense that we have taken care of all the standards which have been set by National Skill Development Corporation, the Healthcare Sector Skill Council. The council has come up with some of the job roles wherein all the national occupation standards have been defined, which are of international level, and the qualification pack which usually is given by the Healthcare Sector Skill Council is they consist of all the qualification and occupation standards related information. The qualification pack number here is 3001, and what we discussed today is of paramount importance in particular healthcare sector. As I go forward, let me give you little bit of the healthcare industry, which is amongst the world's largest developing industry, responsible for preventive care, rehabilitation, palliation, and they are required with good services, skilled manpower. They are multidisciplinary dependent disciplines which require a heavy investment of skilled professionals as well as assistants. These assistants may be, other than vision technician, they may be diabetic educators, general duty assistants, home health aide, cardiac care technician, etc. Now, vision care technician is one of the preliminary course. Once a student clears this course, he can go for optometrist course, wherein he becomes a master in refraction related skills, where he has to set the powers of the patient, he has to set the complete eye lenses required by the patient, and all these are taken care of by optometrist, refractionist we call it in other words. And today we shall rather limit ourselves only to the vision technician. Now, what vision technician will do is that they would prepare the patients for vision test, record the histories of the patient, explain the usage of glasses or any medicine prescribed by the doctor, ophthalmic doctor, schedule the appointments, and take care of the data which is coming out of the examination room, and keep the vision clinic entirely free of any dirtiness. Rather, we should speak in scientific language. It is keeping the hygienic condition. It is one of the allied healthcare profession, and the experienced technician would assist ophthalmologist, optometrist in controlling the blindness. Vision technician performs some of the administrative and clinical duties. The focus of developing the curriculum was rather to keep the right professional attitude and communicating skills which a technician should always acquire while he is dealing with the patient as after taking the scheduled appointments. Now the area where a vision technician can work, that includes various domain hospitals, ophthalmic setups, private clinics, optical retail shops, where the manufacturing of lens are also taking place, and other lens manufacturing companies. Now this book, which is of class 11, it describes, rather it is divided into 7 units. The first unit starts with the structure of human eye, obtaining the case history of patient, common eye problems, measuring of visual acuity, basic visual assessment, assessing refractive status, spectacles, optical prescription, and other contact lenses. Coming to the unit 1, structure of human eye, eye is just like a sophisticated cameras. They take many pictures per second, and those messages are being processed by the brain, and we see those messages or processed messages in a form of colorful world around us. The important component of this compound eye is a sort of bony socket, or we call it as a orbit, having eyelid, eyelashes. Other important structures may be conjunctiva, cornea, sclera, choroid, retina, and two liquid chambers maintaining the eyeballs. So friends, when we speak of the eye as a whole in our body, it is one of the very complicated function which performs, and these functions are done with the help of muscles. The movements which eye usually have are they are mostly voluntary in nature. Firstly, the principal types of movements, they include both vertical and horizontal tracking and certain convergence related movement. The movement is also taken care of by the pupillary reactions, which controls the lens, in the sense that suppose we have a very bright sunshine, and immediately our eye shrinks. Now all these are taken care of because of the pupillary reaction which controls the lens. And when the sunshine is brighter, the eye contracts, and when the sunshine is a bit lower, say the light conditions are lower, then the pupillary reaction helps in dilating the eye, and the eye size becomes large. Now, retina is a light sensitive structure at the back of the eye that covers the maximum portion of the inner surface of the eye. Now, it is one of the important structure where the entire vision formation takes place. Now, the instruments which you are seeing in front of your screen, this is known as a synaptophore. This particular equipment, it records the muscle balances and other movements of the eye. And it is useful for the doctor in studying the movement of the eye muscles, which can diagnose a lot of the the diseases which usually occur because of the eye muscle movement or a defect in this, like usually children having a squint eye, or their retinas are not in proper shape or in proper direction because of the muscular defective muscular movements. Now, the major role of the vision technician is usually obtaining the case history of the patient once he is inside the vision clinic. You know how this information is collected by the vision technician, and why it is collected. It usually helps the doctor to obtain the information from the patient, their background, their working condition, their medicinal allergic condition, if any. All this helps the doctor to formulate treating the patient in a proper way. The information which is obtained this way, together with the examination, enables the physician and other health professionals to diagnose and prepare a proper treatment plan. Now, what type of histories are usually, or the information usually are obtained prior to the patient entering the room of an ophthalmologist? They are their past medical history, which of usual health questions, their ocular history, right, like if they have undergone any surgeries earlier, or they had any cataract surgeries, or they had any eye trauma, eye infection, or they are unable to see properly, or their images are not formed accurately. Then family history, the focus would be on regarding the occurrence of glaucoma, or does a patient have diabetes, whether his other family members have any diabetic-like uh, disease in their family, does he have any blindness-related problem, that allergies, a lot of basic allergies are there, maybe due to medicine or some environmental or atmospheric condition. Professional history, either he is a farmer or welder or a blacksmith, or he is working for the factories, or is he a carpenter. So any sort of injuries because of the professional history matters a lot for the doctor who is taking care of the patient. And of course, medication is another area. If he has taken any earlier medicine or ointments which has caused some diseases or some allergic conditions or inflammatory things like that. So all these histories are very important for the doctor to diagnose the present eye condition of the patient. Usually what the doctors, they try to see, they try to diagnose within the patient and the condition which may be useful to them. If the doctor, they see that the eyes are red or they are painful, they usually study the lids of the lacrimal system, conjunctiva, cornea, anterior chamber, or the intraocular pressures. And if there is any foreign body in the eye, then the doctor would study the lids, conjunctiva, cornea, anatomical examination of the eye. Now, in the slides coming in the next few slides, we shall be discussing how these examinations are done by the doctor, and in what way the vision technician helps the doctor in assisting ophthalmologist in conducting those examinations. Now, if the patient has a reduced vision, then what are the structures which the doctor would be examining, right from testing the visual field, optic nerve, and macula, and other things. Suppose a patient is having a double vision, then what likely problem he got to face, and what are the structures which the doctor would be examining, like fundus, optic nerve, function. I shall be discussing what these fundus and maculas are all about in our next few slides. Uh, Headache-related or neurological problems are usually faced by the patient. So what are the things which the doctor is likely to examine? The three vital signs that ophthalmologists usually observe, they are like vision and pressure of the eye. Now, if the pressure of the eye is increasing, then usually the test for the glaucomas are undertaken. The visual field test is the method of measuring the individual's entire vision of the eye. And these are done usually by way of ultrasound scan, keratometry, and optical coherence tomography. In short, we call it as a OCT. Now, what are these? Ultrasound sound frequency sound waves are used in measuring the waves, which helps in measure and produce the detailed images of eye. It's just like any ultrasound method which is being done in other organs or other parts of the body. The keratometry, it helps in measuring the curvature of the anterior segment of cornea. The OCT, it is a non-invasive imaging technique taking the use of the light waves to take the cross-sectional pictures of the retina. Now, these are the few methods which usually doctors they keep in their equipments, they keep in their vision clinic, and they take the help of these instruments and equipments to diagnose the related diseases. Now let us come to the another unit which has been described in this textbook. The common eye problems which are usually faced by the patient who are uh, undergoing some of the problems in the eye, and they come and complain to the doctor, eye doctor, uh, like conjunctiva and its diseases, for example. What is conjunctiva? It is just a thin membrane that covers the inner surface of the eye, and which is the part of the eyeball. And sometimes you all might have faced a situation where your eyes are red. This redness may be because of the inflammation of the conjunctiva. And the inflammation usually happens because of some viral infection or because of the bacterial infection. Then conjunctivitis may also happen due to allergic conditions, or maybe because of some of the chemicals where a patient is working in a factory, chemical factory, and because of the chemical fumes, this inflammation of the conjunctiva happens. Then some corneal disorders are also taking place, which is like keratococcus, fungal keratitis, bacterial keratitis, and herpes keratitis. Herpes is a virus which causes a very severe sort of keratitis. One important occurrence which usually happens is a diabetic retinopathy, wherein the patients who are usually diabetic in their diseases, their retinopathy happens, and they slowly they lose their vision. So it is usually important that the patients who are diabetic, they should visit their doctors, eye doctors especially, at least once in a year, and they should get their eye checkup, particularly the retina part, and they should visit the doctor who is usually a retina specialist. Now, I talked of a term known as a glaucoma. So let us understand what this glaucoma means. It is actually a sort of a optic nerve which is progressively destroyed. Progressively means from the start of the diseases, the vision completely gets destroyed. Vision stops, and the optic nerve is progressively hampered, and because of that, the patient under the effect of the glaucoma loses his vision completely, and eventually he is blind. Cataract, it is a problem of eye natural lens which lies behind the iris, where a clouding of the lens occurs, and slowly the vision gets hazy. Myopia, it is the condition where person can see nearby objects clearly, but he cannot see the distant objects. Hypermyopia, it is a condition where a person can see the distant object, but he is unable to read the nearby objects. Astigmatism is another disease where a person suffering from astigmatism has a blurred and distorted images. Now, the unit 4, which describes how the measuring of visual acuity takes place in the vision clinic. Visual acuity means it measures the vision of the person. And the purpose of examination of eye is to identify the most suitable prescription of glasses to provide visual correction. And this is a major complaint with which the patient usually comes to eye doctor. And the major problem is addressed by a suitable prescription of the lens with the power. And for this, we take the help of a refractionist who measures the power, corrected power which is required. This may be done, say, with the help of some equipments which I shall describe in the coming slides. Now, eye care professionals, they have various terms used for that. I should describe it further. That ophthalmologist is a person who takes care of the vision in general. Optometrist is a person who takes care of the power aspects of the lenses, or in other words, we call it as a refractionist. And orthoptist, they are the doctors who take care of the muscular movement of the eye. So all these three words, they describe various functions of the specialties of an eye doctor. Basic examination which is required in this refraction is that a method which is used to correct the defect of vision is called refraction. That may be objective refraction or a subjective refraction. Then we have a visual field testing to assess the central and the peripheral side of the vision. Then the doctors, what usually do is external examination of the eye, like inspection of the eyelids, position of the eye structure, and structure of the eye in general. Then slit lamp examination is done. What is slit lamp? I'll describe it in next slide. It is a procedure where the eye is examined through a magnifier and we get a 3D image of the entire retina. Then the fundus examination, it is the optic discs of the retinal vasculature, which is being studied with the help of a fundoscopy, or we call it as a retinoscopy. See, here is a person who is studying a patient, who is examining the patient with the help of retinoscopy. The other word which describes a retinoscopy is ophthalmoscopy. It usually studies the inside eye structure and the vitreous humor, the liquid portion of the eye structure inside chamber, and it helps the doctor in visualizing the vascular nature of the patient, where the retina and its vasculature is proper or not, whether the vascular structures are drying up or not. This gives a pretty good idea to ophthalmic doctor as to what is the real condition of the eye of the patient. Now, I talked of the person who is conducting refraction. The refraction may be done usually by autorefractometer. Now, these are the two images which is shown before you. This automatically reads the patient and their correction which is required for having a good lens so that the vision is proper. This is the automated part, and then followed by this, the refractionist also does a manual correction through the lenses by trial and error method. Here is the photo of a forcimeter. Forcimeter, what it does is that it is usually very important in the manufacturing units where the lenses are measured. This structure usually measures the power of the lenses. It is also placed in the spectacle shops where suppose the patient does not have the power of the spectacles, so we can easily check the powers of the spectacles of the patient through this forcimeter. And if new glasses are prescribed, then to verify the powers given are the correct or not. To check the powers of the lenses in a laboratory. It is also used to measure the spherical lenses power. Forcimeter is also used to mark the actual optical center of the lenses and to find the axis direction. Now, these are the important aspects of the spectacle development, and the forcimeter is one of the in equipment which is very required equipment. Now, what is the retinoscopy? I said earlier in my previous slides what the retinoscopy says. The retinoscopy is a small handheld instrument that is self-luminous and is used in standard clinical procedures for various measurement of refractive conditions. Retinoscope, they help the expert to understand the position of the image on retina for correction of the refractory errors. Now, this study can be of direct method or indirect method. The direct method retinoscopy is shown here. The doctor who wears a glass, which is a magnified glass, and then takes equipment in his or her hand, which helps to perform the examination of the patient, and it studies the inside structure of the eye of a patient. Now, this is the direct method of retinoscopy. It is the slit lab examination being done by the doctor. As I said, what the slit lab does is that it provides a 3D view of the different parts of the eye, and it helps the doctor to take a stock of the situation wherein there is a problem if any on the gel-like fluid activity of in the middle of the eye, and this helps the doctor to have a pretty good idea of the condition of the eye or the state of the eye of the patient. This is the indirect examination being done by the doctor, which is what earlier I referred as the fundus examination. Fundus examination is nothing but to study the basic vascular nature of the retina, whether they are drying up or not, and this shows the state of the retina of a patient. So this is one of the very important examination being done. It helps to diagnose whether the patient is undergoing retinopathy or not. This equipment is also helpful in studying on the pediatric eye conditions, wherein usually we come across a word known as a retinopathy of prematurity. What this situation is, the premature babies, they usually have underdeveloped eyes, and the vascular condition grows to such a condition that slowly the entire blood vessels, they cover, and slowly it rather proceeds to a state where the patient's retina is detached, and as a result, because of the detachment of the retina, the patient retina is detached, and he or she loses the total vision of the eye, and this we call it as a retinopathy of prematurity. This is the equipment where the doctors take the help of, followed by which laser treatments are being performed to restore vision. This is a medical equipment which is taken care of in several microsurgeries of the eye. Now, coming to the class 12 textbooks, the units which is being described in that textbooks are health and hygiene and safety, vision care clinic, what a vision care clinic is, what are the factors which are there to set up the vision care clinic, what are the various eye solutions and accessories, then what are infection control policies. The storage of medical records is one of the very important aspects of having a data storage for the records of the patient. And the biomedical testing. Now, safety measures, it is one of the important for all the people, including the beneficiaries, even the employees and the management. And every employer or supervisor or a worker, they should share the responsibility to maintain a proper health and proper cleanliness around the area where they are working or in a hospital. Uh, what are the aspects of hygiene should taken care of in the vision clinic are like front door cleaning.
All right. So our viewers, you were understanding the role of a vision technician, and there are so many job opportunities attached to it. Sir was explaining everything about the eye center, what all problems the eye can face, and the examiner, the doctor, and even the technician, how together as a team they work and try to get the vision of the patient back. And there are so many contact lenses available in the market which the doctors advise, and there are medicines, and then there are certain exercises as well, and there are some food habits as well. I am not certain about what exactly food habits are those, but yes, doctors definitely suggest something which are good for the vision. So there was some technical issue, and we'll be back with our expert, and he'll be explaining more about the role of a vision technician, and he's going to join us very soon. Till then, please keep on sending your messages through our YouTube channel ncertofficial. In the live chat box, you can write down your questions, queries, and share them with us. You're watching us right now at PMeVIDYA channel number 9, and if you want to call us, the number is 8800440559. So you can see the number is being shown on your screens at the moment. And yes, the healthcare sector is India's largest market in terms of revenue as well as the employment. So if you are looking forward to being a vision technician, please study hard, please get into its details, what all this job is all about, what all roles do you need to play, and this series is going to stay here. So as you can see that our expert is back. Sir, could you please continue where you left? Sir, can you unmute yourself so that we can hear you? Sir, say something, please.
Yeah, am I audible?
Yes, you are.
Yeah, thank you, ma'am.
Yes.
What I was explaining is some of the conditions wherein the eye precautions should be maintained.
Okay.
These are the very basic precautions which should be taken care of before visiting the visual care clinics. Firstly, wash your face and surrounding areas of the eye every morning and before going to the bed. This is one of the important aspects. Do not use any clothes or handkerchiefs, towels which are used by others. Protect the eye from sharp edges. Protect your eyes while burning firecrackers. Do not see towards the bright light or sunlight, solar eclipses. And if at all you want to see these solar eclipses and all, you should use a proper dark protective glasses. Avoid reading while you are traveling in a moving vehicle. Keep the television at an advisable distance with the adequate brightness around the TV being kept in your room. with proper lighting conditions. Now suppose a foreign particle enters your eyes, then what to do? You need not panic about it. Try to remove gently by some water swab or with the help of clean handkerchief. Wash your eyes with clean water. Put an iron, apply or put some antibiotic eye ointments, but that should be under the prescription of the doctor. And if the foreign body is not yet removed, then consult your eye care professionals immediately. Now, in case of burns, if you have a burn because of the chemicals or the thermal conditions, then irrigate your eyes properly, clean water. Apply antibiotic ointment under supervision. Consult your eye care professional at the earliest. Now, if you have a sort of scratch in the cornea, apply antibiotic ointment 3 times a day for 3 days under supervision of doctor. Apply sterile eye pad and refer to eye care professional. Now, if you have a sort of perforation in your eye, then no eye drops or ointment to be applied. Apply sterile eye pad or eye shield. Eye pad are the cup-like structures which are helped in covering the eyes so that no further damages are caused, and refer to your ophthalmologist immediately at the earliest. In case of any blood inside eyeball, then you should apply eye pads for both the eyes. Bed rest, you should lie straight and refer to the ophthalmologist. Now, there are certain hazards which are usually occurring at the place of your working or in the school. Now, these are the conditions which, hazardous conditions which causes harm, and they are the potential damages that adversely affects the health workers or the workers who are working at, say, manufacturing units. They may be because of various reasons like wet and slippery surface, electrical short circuit, working at heights. Suppose there is a fall from the height and the eye is damaged. And manual handling of certain equipments which causes certain itching or burning sensation. Then toxic gas fumes, fire, there are certain plants. All these factors, they cause the hazardous conditions and they affect the vision of the eye. Before to it, I should say that these conditions, once you are, the hazards are there, or these hazards, they cause this lot of harmful effects in your eye. You should visit the vision clinic at the earliest possible way, without taking care of yourself or ignoring the state of the eye condition. Now, it is particularly for the vision care technician. Sometimes a vision care technician has to face the irate customers. Now, how should he deal with those irate customers? The customers may get irritated because of some other reason. Once he is there waiting in the waiting lounge of the vision clinic. Firstly, is that you should focus on the emotions first, calm, and try to calm the patient. Avoid the escalation of the situation and find out how to help the irate customer. Hear to the customer's complaints carefully and give him a solution how to solve the problem. Note the customer's contact details, and if the problem is unsolved, then forward the information to your supervisor or doctor who can help and solve the issue. If the customer is still irate, ask for the help and see the safety tips for various situations like shoplifting, robbery, or harassments, which are usually faced inside the vision technician. So these are some of the factors which a vision technician has to take care of. Now, what a vision care clinic should be. It's a unit, a permanent facility, and having a comprehensive eye care services. And uh, uh, for this, the physical infrastructure, staffing pattern, equipment, regulation of running the eye care clinic, health education, all these things should be known by the student or the vision care technician. The role and functions of vision care clinic is they are mostly for eye detection and examination, testing vision, refraction, etc. The stuffing pattern should be as like optometrist, vision technician, and ophthalmic nurse. And this I'm talking about a domain like hospital where nurses, refractionists, and ophthalmic technicians are there to fulfill the objectives of a complete vision care sector. Now we come to a very important unit wherein people, instead of putting spectacles, they use contact lens. And for using contact lens, a lot of solutions are being used. And these solutions, they are either of cleaning nature or disinfecting the nature. They are used for, say, no rub solution like things where the patient usually keeps those contact lenses inside a box, and sometimes while putting on those contact lenses, the patient gets irritation in his eye. So instead of rubbing, we put solution into the eye, which disinfects the eye as soon as possible. Eye contact lenses purchased required to be kept clean. For that, various types of solutions are available in the market, like multi-purpose solutions. They are unisex designs, and both the genders, they can use this contact lens solution. They are usually lubricant in nature. And the lubricant means they match the status of the eye tears, which are found inside eyes. The pH of these solutions match the pH of the tears, and the contact lens solutions, they help to fight against germs, keeps the contact lenses clean. Now there are various methods which causes the wear and remove the contact lenses. Like you should keep your hands clean. You should keep the lenses properly inside a box which is given by the manufacturer, and then while putting on the lens inside the eyes, taking out of the lens, what precautions you should follow. All these regular methods are being described in the textbooks. Then we have to take care of the contact lenses, which are very, very careful. But the major problem which we usually get is the extended wear of these lenses overnight should be avoided, and this rather causes a lot of problems which the patient feels uncomfortable with the use of contact lenses. So all these points are being described in the textbooks, especially for class 12 standard. So I complete my today's sessions. If any queries, if I can address those queries, I would be rather
Yes, sir.
happy to do.
Thank you so much for this entire explanation and for sharing the platform with us and the viewers who are watching you and me. We have some things to ask you. So regarding this, there was a section which said that obtaining the case history of the patient. So why do you think that is important for the technician or for the examiner?
A patient might be suffering from a disease wherein his family history matters. So if a doctor is unaware of those family histories, the appropriate methods cannot be adopted with the doctor. So like if a patient's family is suffering from diabetes, and the patient himself is also suffering from diabetes, he is bound to have this state where he attends the status of diabetic retinopathy, which is nothing but a total detachment of the retina and the loss of the vision. So unless the doctor is aware of all these conditions, he will not be able to solve the problem.
Right. Okay. Okay. So, sir, there were certain precautions also you mentioned that stay away from the burning crackers and stay away from the sharp objects. So the retina should not be injured. Basically, that is the whole point.
Yes.
So, if we talk about the age criteria, with age, does it affect the vision?
Yes. With the age, what happens is our muscular movement of the eye gets affected, and because of that, the adjustment of the eye lens, which is taken care of the muscular movement of the eye, gets affected. Okay. And you will see that after the age of 40, we are unable to read properly. The near vision gets affected. So these are the things which should be taken care of once the patient is above 40 and above.
Okay, so are you saying that after 40 everyone should use the spectacles?
Not necessarily. He has to get them prescribed by the doctors. Maybe some patient, their muscular state is very fine and they don't need those prescribed classes to read. So it is not needed. It's not a thumb rule as such.
Okay, and how often do you think a patient should go to the eye specialist for the eye checkup?
See, if a patient has met with an accident or some hazardous condition, then he should immediately go to the ophthalmologist. Okay. But if the patient is, say, myopic, if he is using a spectacles which is of minus power, and he is unable to see the distance of distant placed objects, then he should visit the doctor once in a year. And suppose if the patient's powers are very high, the lenses power is very high, then he should get his retina checked up at least once in a year, so that the glaucoma-like diseases are kept away and we can keep track of any such conditions which may be developing.
Okay, okay. And sir, apart from the medicines, what do you think an eye specialist suggests some exercises or even some food habits? If I'm not wrong, vitamin A is really good for the eyes. Am I correct?
Yes, ma'am. That's correct, ma'am. Vitamin A should always be prescribed to the growing child as well as to our age group of us like patients. And for that, you can have either allopathic vitamin A prescribed or certain vegetables which helps us in getting the vitamin A out of those.
Okay, okay. And that is for everybody, be it a child, an adult or an old person, right?
Yes, yes. Even there is a scheme run by Government of India and the scheme is helped in implementing and this executed by frontline health workers. And they are giving a drops of vitamin A to the growing child in the malnourished conditions and other areas, in rural areas, I should say, where people are not aware of all this.
Okay, okay. And so, what do you think the eye problems are faced by whom more? People living in the urban areas or people living in the rural areas? Is there any difference between the environment of these two?
Yes. See, as far as rural area is concerned, the workers who are, say, of illiterate or uneducated, they may get some state of eye condition wherein they don't understand the effect or the implication of that, and totally they proceed towards blindness. So that can be avoided if they are given awareness of it, and immediately they contact their ophthalmologist. And as far as urban areas are concerned, people are aware of conditions, so they immediately visit the ophthalmologist and they take their prescribed glasses as soon as possible. So that is the good part of it.
Okay, okay. And the surgeries regarding the eyes, are they all major or some are minor? And what about the laser lens these days? People get them, instead of using the daily basis lens, they just get it permanently. So is it safe to get it done?
The surgeries, they are usually being done for those patients who are having a squint-like eyes. Their eyeballs are not in the proper place. So to remove that muscular movement-like effect, which are defective in nature, surgeries are usually done. As far as other surgeries, they are done at the old ages where a cataract operation is required, which removes the original lens and then we fit into the lens which is artificial in nature but of the same nature. So these surgeries are required during these two conditions. And as far as the laser surgeries which you asked, is today we have a procedure we call it as a LASIK, L-A-S-I-K, LASIK, which helps in restoring your retina and to minimize your spectacle power so that you become spectacle free and you did not use any spectacles. So these kinds of surgeries are usually performed by ophthalmologists.
Okay, okay. And do you think watching the screen for a long time that affects the eyes?
Yes, yes, yes. It is known as the computer vision syndrome, we call it. Nowadays, the online classes being done by the students, and their on-screen time is more than 1 hour, 2 hours at a stretch. So that should be avoided. What happens is, continuously, if you are you are staring at the screen, your eyeballs get stuck up, and it affects the muscular movement. Firstly, secondly, the vitreous humor of the part, which is a gel-like substance inside the eyes, they become in a watery state-like things, and you feel certain floaters are floating inside your eyes. So all these things can be avoided if you say every half an hour, if you stop looking at the screen and then look at a distance place, and then again you come back, shift over to the screen. So this helps to restore your vision.
Okay, all right. Thank you so much, sir, for sharing all this information regarding vision technician, which comes under the sector of healthcare. Thank you, sir, once again.
Thank you. Thank you.
Thank you to all the viewers for watching this entire program. I hope you liked it. And this is an online series, Meet the Author, of vocationalization of school education. So we come with this series every day at 12:30 p.m. on our channel NCERT Official. So do watch every day. It's a new topic, it's a new sector, and these are really helpful for all of you. Stay with us, don't go anywhere. At 2 o'clock, we are coming back with an Urdu class for all the 11th class students, and at 3 o'clock, we'll come back with an English class for all the 12th class students. So don't miss these sessions. Keep on watching PMeVIDYA channels and take great care of yourself. Namaste.